people in every nook and corner of the country. But how do you take the customer feedback back into your system? Because I don't see any initiative being taken, and see several customers, helplessly waiting outside the labs, not getting the results in time, and no way of communicating our helplessness and our frustration back to the system and to the right people. So what is being done about that, sir?
See, I know a few days back the whole system crashed, and when our computers crash, it's a real calamity. And the beauty is, it was not triggered by a computer kind of an IT thing. It was triggered by the electricity and something to do with the rain. And the electricity would keep on coming and going, and even the generators which come on automatically, they went off. And once the thing crashes, then the results which are already there in the system disappear. So you're quite right. That happened on one day, and we really had a tough time that day. But this, I believe, happens in every industry. It's once or twice it does happen. And as far as the feedback is concerned, well, we have feedback forms, and in fact, we receive and not because I'm sitting here, but we normally receive a very good feedback from our customers.
So with that, thank you very much to this panel. Appreciate all your comments. One quick question.
My name is Dr. Rafiq. I am from Hyderabad. I'm an advisor to two medical colleges there. I worked abroad also in primary health centers. So what I think is India requires to reactivate the primary health care system. And there are millions of NRIs who are residing outside. If one NRI adopts one primary health center, though we can reach the unreachable, which are in millions and millions. And that primary health center reduces, it is a step towards preventive aspect.
No, absolutely, Dr. Rafiq, and you will hear about some of the innovative work which is being done in primary healthcare by one very enterprising startup in this coming session. So just wait there. Thank you very much. Thank you. No, I'm sorry, because otherwise Shobha is going to kill me. She's looking at me as if she's going to massacre me.
Okay.
Thank you.
All of you can clap.
Can we have So, ladies and gentlemen, we'll now do the second session of the re-engineering panel, or the thematic panel. And the idea was that just after we finish with the first wave, which is India Healthcare version 1.0, we will have a nice discussion around how companies in this country, and particularly from the startup ecosystem, there is a very vibrant new healthcare delivery opportunity that is emerging. And obviously there are challenges besides the big opportunities that they are chasing. And so therefore it was important to sort of give the voice to the startup ecosystem of the Indian healthcare landscape. So to my right is Aditya Burman. Aditya is the director of Onquest Laboratories. On his return to India in 2004, Aditya joined Dabur Pharma, a specialist organization in the manufacture of global distribution in oncology pharmaceuticals. Later, he joined the Onquest Labs, and under his guidance since 2004, Onquest has continued to innovate and bring many first-to-market assays, which are basically diagnostic tools in the diagnostic industry. Since 2008, Aditya took on the exclusive role of director in Onquest, in which he continues till date. So it's about 8 years now that you've been on the Onquest run. So it'll be nice to hear some of the experiences. To my extreme right is Kaushik Sen, CEO and co-founder of HealthSpring. Kaushik, I've known Kaushik over the years from the time of his, when he was with Bain, and India's pioneering and leading pharma primary care provider is what Kaushik is trying to do with HealthSpring. So prior to funding HealthSpring, he worked with the management consulting firm Bain & Company in Boston, Singapore, and Delhi for 11 years. He has pursued his undergraduate studies in Colby College with a major in mathematics and economics, and received his MBA from the Harvard Business School. And he's on this journey of, creating the primary healthcare network in India in a totally new ecosystem. So, Kaushik, would love to hear some of your experiences. To my extreme left is Mr. Lalit Pai. Lalit Pai is the CEO of home healthcare company called Nightingales, and he is, he's basically running Nightingales, which is the specialty home healthcare provider group under Medwell Ventures. Prior to Nightingales, Lalit spent a decade in Quintiles, comes from a very, very strong clinical research background. He headed up the cardiac safety services, the IVR business unit, and was also involved in building a large offshore software development operation in India. Before Quintiles, Lalit has worked with Mphasis in Singapore and Shanghai as business manager for their Southeast Asian business. And earlier to that, he's worked in Citigroup, Tata Industries, and PricewaterhouseCoopers. On my left is Manoj Gopalakrishnan, who is the CEO of HCL Healthcare. Manoj has got a vast experience of 2 decades in the Indian healthcare industry. Before joining HCL, he was heading the South Asia operations of BD, where he drove growth through shared value creation. And prior to his career with BD, Manoj held positions of increasing responsibility with Hindustan Latex Limited. So, a very interesting panel. Diverse background in terms of what each one of them have done in their past lives, and more than everything else, you can see that there is this intense talent which is chasing new growth opportunities in the Indian healthcare ecosystem. So, question number one, to this panel, and again as an overarching question, the same way as we did for the other one, do you think this is a great time to be an entrepreneur in healthcare in this country? Kaushik, over to you.
Sure. I think people ask me what it takes to be an entrepreneur. I say the number one thing that you need is resilience. It's always tough to be an entrepreneur. I think at the same time, I think entrepreneurship more than anything else offers you the opportunity to really change and transform the context that you're in. And so I think it's an exciting time to be an entrepreneur. I think there's an increasing recognition that the solutions that we need as a country, we need a lot of talent chasing those solutions. I think it's also a recognition on the part of, I think, many people in the business community that entrepreneurship is something that essentially is business learning on steroids. And so even if you fail, there are opportunities beyond that as well. So I think those things are interesting, and I think there are an increasing focus on investment opportunities. We've been through about 5 rounds of funding. I think 10 years ago, companies in our space would really struggle to attract funding. So I think all of those things add up to something which is important. It's an exciting time to be an entrepreneur.
Sure. Aditya, you come from a family of entrepreneurs, and you've chosen the tough task of being one yourself. So, good time to be in entrepreneurship, or not so great time to be an entrepreneur?
I must say, I think it's always a great time to be an entrepreneur in Indian healthcare, at least because the opportunities are so vast. There's so much to be addressed. That being said, I completely agree with Kaushik. It's a better environment. It's more nurturing, I should say. More organizations, more focus. Now organizations have specific courses for entrepreneurship, and I think that's really helping things out. And I think the biggest part about this is that we have the tools now available to us to kind of use in new and wonderful ways. When you have a hammer, everything looks like a nail, but when you got a full toolkit, you can kind of get a little adventurous. So yeah, I think it's a good time now, and hopefully we'll get better.
Sure. So Manoj, HCL Healthcare, whoever thought that one of the leading IT companies of this country would venture into healthcare? So what makes HCL get into healthcare, and how come you wanted to chase this part of the spectrum?
Sure. Thanks for having me on the panel. So I think the question that asked, how can somebody who is not a healthcare guy get into healthcare? So I think now across industries, that's a new model. like in the automotive industry, who is creating the new standards? It's basically Google and Tesla. It's not Ford or it's not General Motors. In the case of retail, who is setting the new standards? It is Amazon. It's not Walmart. So I think across the board you see that innovation is a new name of the game. And when we looked at 3 years back in the healthcare space, HCL actually saw that there is a lot of convergence coming between the best in clinical medicine, diagnostics, information technology, and data. And that was a kind of a powerful convergence which we wanted to be at the forefront with. So that's the intersection that really excited us really get into this space.
Good. Lalit, good time to be an entrepreneur?
It's always a good time to be an entrepreneur. But more so now, I think I agree with everyone's points. In many ways, the ecosystem is becoming more mature, and therefore, I think the good or the bad thing about healthcare is really it's a long life cycle industry. These are not .com kind of operations where you see some change immediately in 3 months' time, 6 months' time. It takes years. It takes years, and sometimes I think the point that Mr. Burman made was very, very true. It requires, or maybe Kaushik made the point, that it requires a lot of patience. And I think in this time and space, the ecosystem, the people participating, either the stakeholders as well as the investors, I think have got more patience and have more space to let entrepreneurs grow their own thing. So yes, the answer is yes in my mind.
Great. So a lot of positive energy over here, and so let's get down to the basics, right? Let's get down to what are you really trying to do in this space, Kaushik, and particularly with HealthSpring. I know you took on primary healthcare as your choice of the vertical, and how has the journey been? I'll come to the challenges later, but what kind of opportunity did you see, and what kind of gaps did you see which you are trying to fill through this venture of yours?
Great. So, I'll answer the question in two ways. One is to talk about why we chose primary care, and the second maybe just to give you a sense of our journey in terms of numbers. I'll keep both of those answers short. I know we're running short on time. Primary care for us feels like the pivot point of healthcare. If you get things right at the primary care level, you have the potential to really transform how people's healthcare outcomes are affected throughout the chain. You also have a tremendous system cost impact. I'll talk a little bit more about that as well. And from a consumer perspective, that's tremendously important. We look at it as our goal to keep people healthy and to keep people out of the hospital to the extent possible, right? I think those words are important because we're not purely trying to keep people out of the hospital. We want to practice appropriate care. And I think for patients as well as payers, whether they be patients themselves, you've heard 80% of the pay is out of pocket, or health insurance companies. I think both the health outcomes and the system cost impact is a really significant one. And primary care, I think, is uniquely positioned to deliver on it. I want to talk about two other sets of people as well. One is doctors. I think a lot of us think that all doctors have thriving private practices. I think our vision is that if you can create gainful employment for doctors, you can create a program where many of the things that we expect of the corporate world, good training, a clean, ethical environment, focus on career path, trajectory, I think all of those things will really help a very large number of doctors find a good home for themselves. And I think that's something that we really wanted to do as well. And the third is, we look at the other players in the healthcare value chain, and we think that strong, robust primary care, which keeps people healthy, but then escalates appropriately, neither holding people back too long nor pushing them up too fast. I think that's a significant positive for all the hospitals in the space, for the other healthcare providers who can then focus a little bit more on healthcare outcomes rather than on patient acquisition. So those are the reasons why we felt that primary care was something that we wanted to do. We felt that no one else was doing it. We talked a little bit about version 1.0, version 2.0. Version 2.0, no one was looking at primary care. We felt that that's the biggest need. I'll just talk about our journey in just a few numbers, and then I'll hand over to Aditya. We're at or will be in a couple of weeks. We'll be at 36 clinics across 4 cities. That's our retail focus. We also have a significant number of corporate customers. We're at more than 125 corporate customers. That actually we deliver in about 33 cities. So we're quite spread out from that perspective. We have 950 full-time employees. Every employee at HealthSpring is full-time. 60% plus of them are women, so that's something we're really proud of. At the centers, we're 75% women, so very women-focused company. We've treated about 4.5 lakh patients. A few healthcare outcomes that I'll just talk about. We've seen about the diabetics under our treatment. We run our own chronic care program. We've seen about a 30% reduction in the critical parameters of diabetics. When we look at corporate customers, we've treated corporate customers at scale. We categorize into high, medium, low risk right at the start. We've seen about a 30 to 40% reduction in the high risk percentage when we've done multi-year engagements with companies. In terms of our escalation rate to hospitals, we are at lower than 2%, with about 1.6% of our patients going from primary to tertiary. Very proud of that fact. We also run our own emergency response network. We have about a 82% recovery rate. That means when we send a doctor home to you, about 82% of the time it doesn't require further escalation. And these doctors are really well trained and they carry a full emergency kit with them. Last but not least, we have a customer satisfaction score that we call Net Promoter Score, which really asks a simple question of how likely are you to recommend us to your friends or family members. And we look at the promoters, which are the 9s and the 10s, versus the detractors, which are 6 and below. We are at an 85% Net Promoter Score. So that's something that we take a lot of pride in. So that's the journey that we've taken so far.
Thanks,
I'm happy to talk
Roshan.
more about it.
Yep. Exciting. Aditya? OnQuest and diagnostics.
Serious numbers there. Yeah, I think it's people like Dr. Lal have really paved the way and kind of cleared a lot of the undergrowth, if you will, that sets makes our path a lot easier. But we still feel that there are niche areas which need specific addressal. There are key areas which not too many people are looking at, just simply because it might not be big enough, or it might not be, or it might not have been prevalent enough when certain ideas were put forward. So we look for those. I think in our experience, it's been our specialized assays. In our experience, it's been the clinical trial support, and of course the hospital lab management. These are areas where we found significant foothold because we felt that we were addressing a need gap. Now, was this a specific, did we write this all down and say, okay, now we're going to charge forward and get this? No, it was a lot of serendipity. Some of it manufactured, some of it God sent. But at the end of the day, when we took advantage of that, it was for a reason. We felt it was something that we could address with the skill sets that we had and the mentality that we had. So that's something that we've kept strong on.
And this is primarily focused on oncology?
Primarily oncology at the moment, but we are, at the end of the day, oncology is very, it's very broad based. There's a lot to do with the internal environment. There's a lot to do with the genetics. So we feel that expertise, that's why we say specialized rather than specialized oncology, just simply because it has further applications. And we feel that those further applications can very well be imbibed going forward. Oncology, of course, was our mainstay. It was, from the days of from the pharmaceutical company, which was more focused in oncology. But at the end of it, the skill sets are very similar. We feel that we are addressing markets well beyond just oncology, and I think that specialized understanding on certain customer bases suits them well. Because one cannot paint anyone with a general brush anymore. Everybody's kind of got their own bucket. Some buckets just have more needs than others, and we feel that perhaps we can address them a little bit more specifically, if not better.
Okay. So, Manoj, what is HCL? It's been a little bit of a gray zone in terms of what you're trying to do, and so it'll be nice to sort of understand what is HCL Healthcare really chasing, I heard about a few clinics getting launched, but what is new that you're doing in this space?
Okay.
2 years back, we looked at the healthcare space and tried to understand what's the biggest unmet need at this point of time. And we found one of the critical unmet need, as Kaushik articulated, was more into the whole primary healthcare space. So when we look at the primary healthcare space, we actually get a very clear image which is very different from what primary healthcare could do to create value. First, you think of a government primary healthcare center. That's what normally people think when they hear about primary care. Or they see a kind of a solo practitioner running a practice as a primary care. So we felt there is an important need to even look at reinventing primary care, considering the disease burden which is in the country and what kind of episodes get managed in the primary healthcare settings, especially with many of the chronic diseases. You need a much more specialty-driven complex care delivery model. So we felt at one level we need to reinvent the primary healthcare by bringing in the good values of traditional primary care, which is based on the foundation of relationship, the doctor-patient relationship. That needs to be really captured, and we need to have all the essential specialty care integrated at the primary care itself, so that we have a comprehensive primary care model which brings in family physicians, which brings in the needed specialties, the diagnostics, and the other service lines needed to really meet 70 to 80% of the healthcare needs in the ambulatory care setting. So I think we were actually trying to redefine the primary healthcare more towards an ambulatory care model, which is fairly more comprehensive, so that it helps in addressing the acute care needs, chronic care needs, preventive healthcare needs, and comprehensive solution for the population. And we also put a lot of emphasis on technologies like electronic medical record. That became extremely crucial for us because that's the way we used to really manage patient population's record and create population health management programs. And then on the other side, HCL is completely new to healthcare. So we actually worked very closely with Johns Hopkins Medicine in looking at building the clinical pathways into most of the commonly managed conditions in the primary care settings, especially in the urban India. So we actually wanted to go through a very structured discovery process because this is a completely new space. You're actually creating a new model of ambulatory care centers. So that we put up 5 centers in different parts of Delhi and tried to really implement this model. And we got some good early proof points. So today we actually have consistent patient base of more than 25,000 people across the 5 centers. We also rolled out a corporate health program focused on 2 large corporates in Delhi NCR, which again covers around 10,000 employees. So the whole program is focused on preventive, acute, chronic care management in a very integrated fashion.
Very exciting, very different, and it's good to see corporates like HCL going down this path. So Lalit, the latest buzzword in the sector is all about home healthcare, right? And all of a sudden, everybody is talking about this buzzing new opportunity. What is Nightingale's doing?
We want to keep it really simple and really focused. We see ourselves as a specialty chronic care solutions provider. We think that, providing better medical outcomes for chronic care patients by providing them solutions at home will create significant impact in the community, because like Dr. Lal said in the morning, the numbers are staggering, in terms of every chronic disease that we see. And many of them are constrained because they cannot access the primary health or the secondary, tertiary healthcare centers. So our model is very focused on providing care at home, providing medical outcomes, which means that you have to provide comprehensive care at home, and by measuring and then communicating those to the next of kin, to the doctor community, and making sure that that continuum of care that is being that is really critical for the patient to sort of recover is established and has a lot of comfort from all the stakeholders in the community.
And are you doing it on a pan-India basis, or like Manoj
Yes.
said that they are targeted in Delhi right now? So
Yeah, let me try and compete with Wellspring and HCL. No, we are a young company, so we are in 3 cities now. We are in Bangalore, we are in Hyderabad and Mumbai. We've got 950 people in our company now, across doctors, nurses, physiotherapists, and therapists of all kinds, including on the mental health side. And we pride ourselves in, again, making sure that all of these employees, all of these staff are employed by the company rather than contracted by the company. because we believe that for providing quality care, it's very critical that training and measurement of what is being delivered is required, and that we can get only by employing people rather than contracting them. So we are 975 people last month in these 3 cities. Over the last couple of years, if you look at the kind of numbers of patients, we've around 12 to 15,000 patients is what we've served in the last couple of years, and these tend to be clustered around chronic areas like stroke, COPD. A lot of our work happens in these chronic areas. Not to say that we don't do others, but that's where most of our work gets done.
Okay. So, for this whole panel, we keep reading every day. You open Economic Times and you get so super excited by the fact that, the startup ecosystem in this country is the only ecosystem that is left, right? Millions of dollars and billions of dollars chasing new ideas. But I know it for certain that it's not an easy path. So would like to know, and I'm sure that there are some people here in the audience who are also bubbling with new ideas. Would like to know what have some of the challenges been, and from a company perspective, from your own personal perspective, all of you have left very enterprising careers to go down the path of entrepreneurship, right? So what was the journey like?
Sure, I'll start. I think nothing prepares you for entrepreneurship, right? I think that if you're trying to do something for the first time, I worked in a quite stressful role prior to this, but I would say that the stuff that you do as an entrepreneur is maybe an order of magnitude more stress than you've ever faced before, and you're always you're always tasked with this level of prioritization, because there's always 20 fires that are burning, and you're trying to put out the ones which are burning the hottest, the ones which are right under you, but you're looking out for the ones which are 6 months down the line as well. I think in terms of challenges, look, I think attracting capital is a challenge in India, right? I don't think we should downplay that. I don't think in healthcare, especially if you're doing something which is a little bit off the beaten path, like all of us are doing, I think it isn't the easiest thing to get funded. It does get easier, but I think it isn't as easy. Second, I think that attracting good people is a challenge. I think getting people to leave stable careers in India is still a challenge, right? And I think that it's different if you're in the e-commerce space and you're looking for a bunch of young people coming out of the IITs. But if you're in more established businesses which require skills which have been built up in consumer and retail and healthcare, getting those set of people to leave quite established careers, that's a big challenge. So I think those are a few things that are challenging. I think the one advice I would give to anyone who's thinking about it is, don't think about the headlines in terms of valuation or any of those things. You just cannot think about it, because you're not going to monetize for a very long time. If you monetize, if you're one of the lucky few that survive enough to monetize, you need to do something that you feel passionate about, and that's what's going to keep you going.
Yep. Aditya?
India's a really...
Did you really face the pressure?
Well, I think for us it was we've started, I think, over the last sort of decade and a half. We've got 5 companies on the go right now. Some similar spaces. We've got something in healthcare and home health and training and education and this and that. But I think India's a crazy place. It's an amazingly unique market which you can't really put your finger on and say, oh, it's like this or like that. I think the learning has really been that to copy the West is foolish. To only copy the West is foolish. I think there's a lot of the downsides to what we've seen happen over there that we can just completely jump over using technology and our sort of Indian get up and go. I think that's really been quite a big part of how we've got to where we are today. Some good, some bad. Jugaad isn't always a good thing, but sometimes it really just does work. And I feel that this is something that we've seen all around in many different instances. I think the one thing that I've really kind of realized, and probably this is mostly over the last year, is that we haven't come close to the power of the computer in the pocket. We don't understand it yet. We think we do, but we don't. I don't think that globally we understand this. There's going to come a point where all this inane stuff that's going on right now, this Pokemon Go, right? I'm sure people have heard of this. It's real-time virtual layering across the globe, which is amazing. And to say that, oh well, yeah, people are using it to catch imaginary creatures on their phone. People think, okay, well, they're probably on drugs, but that's not how it is. This is some real life stuff that could, in due course, have huge implications in healthcare. Whether it's remote diagnostics, whether it's remote surgeries, whether it's remote consultations. This is all going to happen in real time. It will no longer be this time lagged and this and that, because these are the same guys that are going to be working on these kind of things going forward. If it's not the exact code, it'll be at least the fundamentals are going to be used again and again. So I think that's something very, very good. The other thing is access to capital. I found, this is really the chronic problem of India. This is the chronic disease of India. People ain't got no money.
Even when they have money, they have no money.
Right. And this is, I think the affordability of what can happen if those funds can get to the people that need them in a cheap enough way. I mean, you've got these online, app-only banks and things coming up now, mobile wallets and whatnot. Can we take advantage of that to really just kind of skip over a bunch of red tape and just get right to the point and say, okay, there you go, whatever you had in your pocket yesterday is the same thing, but so these are all ramblings of various different things, but I think it paints a picture of a very unique country with a lot of opportunities.
So Manoj, I heard Mr. Shiv Nadar say once that I will incubate a company, but that's where it is. And then it is for that company to find its own path in life. Now that's incredible, coming from a company like HCL, which could have, said that, we are here for the next 25 years to keep burning cash because we have huge profits coming out from the other side. But I know that there is tremendous amount of pressure that he's creating to keep this company as a startup ecosystem. So, so what has some of this pressure been like, and particularly from your perspective, how are you seeing the ecosystem evolve, and and how are you facing this entire challenge that is staring at you, because you have taken a segment which is quite difficult to pregnate?
Yeah, in fact, the challenge that I heard from Kaushik and Aditya is quite different from maybe what I live with, because being part of a $7 billion corporation, you started the healthcare program by keeping aside 1,000 crores with a clear commitment to really bring in another 3,000 crores if it is needed. So access of capital is not the issue that I'm actually dealing with. But what's clearly needed for the company to see is that we need to really build clear proof points. The same for any entrepreneur. So you put in some early amount of capital in, incubate, build the proof points, and then get the source code right. I'm just using an IT terminology. So for us, actually at this point of time, we are building the source code for the ambulatory care centers. So I think we are getting closer to that. And the moment we really get to see that, okay, these centers really get to the level that we want, then actually we deploy the capital to scale up nationally. So that's the kind of clear intent behind it. So what keeps us awake in the night is primarily, are we building the right proof points? Do we see that we have a sustainable business out there? Are we creating value for the patient? Is it a really patient-centric health system? So I think that's where we are building in innovations like electronic medical record. This is again the first time possibly in the outpatient care setting, putting a lot of premium on basically pathway-driven care using electronic medical record. So on all these steps, actually we are building proof points. Are we improving outcomes? Are we really creating long-term value? Are we really lowering cost in the long run? So for us to really grow to the larger national level, we also need broader ecosystem support. And one of the key ecosystem support is a payer mechanism. Because the way the whole integrated healthcare delivery model will come in, where actually you pay for the outcome to really lower the cost, that's when possibly the real value of ambulatory care will be seen. So I think we are preparing for that tomorrow.
Okay. So Lalit, what are some of the challenges that's keeping you awake
It's always
He's got
difficult.
excess of capital and he doesn't
Yeah.
sleep. He's got no capital and he doesn't sleep. Where are you?
No, but it's always difficult to be the fourth person because all of the challenges that they face is us as well. But let me not talk about capital and the good people, I mean attracting good people, because it is part of what we live through. But I'll talk about two others. I think the first problem we faced when we started was we were trying to change behaviors. And that's something we realized is very, very difficult. So we tried to sell health and wellness. And as Dr. Lal said in the previous session, nobody wants, I mean, there's a sort of fatalistic attitude. People don't want to really invest in health and wellness. At least there is a small segment, but it's not big enough for an industry to sort of grow. So we've pivoted, or we've grown into the chronic care segment. Not that we will not do health, but I think that is still a little far away. From a community or a society point of view, I think it's a little sad. And that is a big challenge. How can we change people's thinking to become more health-centric, to become more wellness-centric? People understand disease more easily. So that's the first one, I think, is a big challenge for us. Mm-hmm. The second one is infrastructure. Look, in our business, 20% of our cost is logistics cost. We have to get the care provider, the doctor, or the nurse, or the physiotherapist to the patient instead of the reverse. And I spent 5 hours from Delhi airport to come here. So, if it's the day in and day out of people in our job, reaching people's homes, and again, the success of any business model is based on two productivities, labor productivity and capital productivity. So ours is not a capital intensive business, it is a labor intensive business. And for us, it is critical, super critical, to become productive on that labor that we invest. And that will become better as the productivity of that person on the road becomes better. So infrastructure in these cities that we operate in is very critical. And how we can get smarter around scheduling better, how we can get smarter about optimizing logistics is another big challenge for us. So I think these two, behaviors, changing mindsets, and logistics is really a big challenge for us.
So let me go backwards this time before we throw open some questions to the audience, because I'm sure that there are a lot of questions for all of you here. In the first panel, my idea was basically to talk about healthcare version 1.0 and where we have come. And obviously, I think each one of you are looking at the consumer and saying that the consumer still looks at healthcare delivery and is still looking for healthcare delivery, which version 1.0 has not delivered to as yet. So there are some gaps, and so therefore the consumer is wanting a new innovative methodology to receive their healthcare services. So the question to all of you, and starting with you, Lalit, is has the consumer really accepted your model? Because the proof of the pudding is in actually the consumer beginning to utilize it, and the consumer fundamentally saying, this is India Healthcare version 2.0 that I'm absorbing and that I'm willing to pay for.
Yeah.
So what has been some of those proof points that from a consumer perspective?
Sure, yeah. So the short answer is yes. In our case, I think we were fortunate that we are not trying to do, there is a clear gap. I think the gap for a chronic patient is that from an acute care setting point of view, there are plenty of options. We talked about public health care, we talked about private care, private health care. So when you have an acute episode of COPD, or if you have an acute, you have a stroke, you know where to get your first point of care. It's what happens after that. And right now, the state of India is that after that, you are left to the mercy of a lot of mom and pop operators who behave in a very, very resource constrained manner. It is mostly people that are being deployed rather than a process or a thought process. And therefore, I think the advantage we had was getting into that segment, creating that continuum of care with the acute care facilities by providing more consistent and technology-enabled services which will help people get better at home. So from that perspective, I think we were better off. That has hit a chord in most people because right now there is really nobody out there who does that in the way we do it. So we've seen a lot of customer uptake. We are growing very quickly in every city that we operate in. We are hitting interesting milestones which we can discuss in another forum sometime, because ultimately a lot of the entrepreneurship of the current generation, and generation I mean last couple of years, is based on profitability, and path to profitability. So I think we're hitting very interesting milestones in that, which clearly indicates that we are able to deliver a service to a customer, and we are able to make the delivery happen in a manner that is sustainable and in fact profitable. So I think that's a good point for us.
Manoj, what about you? And how is the consumer accepting your model? And is the consumer delighted by the fact that they are now finding this whole new ecosystem of primary healthcare emerge?
I'll go back to maybe the morning discussion point which Mr. Shrike Mishra talked about on one aspect of hospital care vis-a-vis the healthcare. So I think overall health being the kind of value proposition is something which we are seeing resonating. But then at the same time, we have realized that outpatient care is more or less out of pocket. So in that, are people really seeing value? So we are seeing that certain segments of the population, especially if you look at migrated urban professionals, so that's one segment where we are seeing good resonance of this value proposition. So that's where we are building the traction.
Okay. Aditya, how is the consumer responding to to your model of diagnostics?
I think for us it's been about getting depth, understanding specific niches, as I mentioned, of consumers. We've done a lot of work in the B2B area, working with hospitals, working with pharma companies, working with CROs, understanding their needs, and that's really worked out nicely for us. I would say that the systemic affordability is probably more than. Specifically, it probably becomes a little bit less, just simply because if you give somebody what they need, specifically what they need, the outcomes become better. But to give them that specific thing, it might cost a little bit more. The trick is to keep it within a reasonable amount, because premiums in India is again something not very well looked at. I'll make do with the other bit. That's fine. We look at it slightly that, okay, well, if we can just give it to you with just enough more to actually make sure that you get what you need for that specific thing. So for instance, like hospital lab management, that's something which has worked out nicely for us because we understand their needs, and it's worked out over time because we've given it specific attention. So I think that's definitely helped our acceptability, is the depth that we've gone to in each of these instances that we've gone after.
So Kaushik, how is the consumer responding to your model and acceptance of your model?
I think the acceptance of the model is good now. I think it's taken a while to get there, and I think that's something that's been a big learning for us. I would say, we take a look at some simple revenue metrics. How quickly does it get us in each new center to get to a certain revenue threshold or a certain number of patient threshold? We're 6 times as fast in wave 5 as we were in wave 1, which sounds great. But wave 1 was 6 times longer than it should have taken. And I think the challenge that we've heard it articulated by many of the dignitaries this morning, etc. as well. The thing with healthcare is we do tend to ignore it, right? We tend to ignore it. We tend to bury our head in the sand. We tend to be fatalistic. And unlike in a consumer retail model where trial is actually fun, right? You open a new pizza place, everyone wants to order the pizza, right? No one wants to come to a new healthcare place, right? Unless they really get sick. And then they'll ask 10 people, and so it's very hard to get that customer to come and try you out. So we've gotten a bit smarter about creating trial. But the last piece I'll say about this is actually very refreshing from our perspective, surprising as well. We find that a significant number of our regular users, much higher proportion than we thought would be, are 50 plus. And we were very surprised by it because we felt the early adopter is going to be the younger, more traveled population. But I think we're a throwback to what primary care used to be 20 years ago. Doctor had time, doctor had more of a continuous relationship. And so that's been a nice surprise. So there are lots of nice positive surprises, but there's a lot of pain as well in terms of getting to customer acceptance.
So let me go to the audience before we sum this up. A couple of questions. Yours.
Yeah, so my question is in continuation to the point raised by Mr. Manoj on the payer system and how it does not currently, no one is actually incentivized to keep patients outside of the outside of hospitals. So how do you see this changing? And anyone could take this on the panel with the role of the payer changing from a funder of episodic events and episodic care to more of a disease management partner for the patient. I know it'll take a while, but I think it would be a very good symbiotic fit, given that home health care can help reduce long-term cost for the payer if the payer starts funding for it at this point.
It's a good question. So, Lalit, you want to take that since he said what are you seeing from the payer perspective?
Yeah, so I think a couple of points. One is that given that the industry is regulated, I mean the insurance industry is regulated, I think it takes more time than what would have normally happened. Having said that, I think all of them are going through various trials in terms of what are the products that need to get into people's hands to get the result that you mentioned. Everyone's very clear that health has to be incentivized and staying healthy. I wouldn't say staying out of hospital. I would say staying healthy is really the outcome we all desire. But how do you get there is really the question. So I would say that we've worked with a lot of people in the insurance industry who are looking at various trials. The problem also is that there is no other model. So if you look everywhere else in the world, the US has moved from fee-for-service to outcomes only recently, and even that is not really proven at this point. So very few models out there to try, and therefore with an industry in India from an insurance point of view, which is still very, I would say, small and emergent, I think it will take them some time to get to the point that you're talking about. But they are definitely looking at those kind of steps. The second point, and I'll be very quick on this part, the second point is for the insurance industry to really create products and become more widespread, they need an ecosystem of professionals who will be available to provide the services at a pan-India level. I think that's the other challenge that most people will face. You heard 3 of the 4 of us here talking about how we have done good work, but it is in 3 cities or it's in multiple small pockets. There is no real innovation happening at the pan-India level. And that has to really happen before an insurance product becomes truly portable and available across the country. So those 2 points. I wish Sanjay was here to answer that question as well.
No, we'll push him to do that.
For Dr. Kaushik, what do you mean exactly by your primary healthcare system? Is it including all the 8 points: vaccination, maternal and child health care, eradication of communicable diseases, control of endemic diseases, provision of healthy water, emergency medicine, health education? Health education in all the religious places, schools and all. This will bring a sea change. I think India needs this. If we can bring down the budget to 50%, if we train one of the old women there how to conduct a normal delivery, not touching the primary and grand multi, we can save so many complications. That's what I require. And then having a small lab at the district level, so that even a pre-eclampsia patient can be diagnosed there. Simple investigations can bring a sea change to them. Provision of healthy water, that can bring a sea change. Destroying the breeding places of mosquitoes. We are selling billions of dollars of mosquito repellents, but we are not destroying the breeding places of mosquitoes.
Absolutely.
That's what.
Point taken, Dr. Rafiq. Kaushik, can you answer that?
So I'm going to try to maybe rephrase the question a little bit. I think first of all, I'm not a doctor. I'm very flattered to be thought of as a doctor, but I'm not a doctor. In terms of the various points you made, right? I would broadly say that maybe break it into 3 categories. One is healthcare provision, right, which includes all of the pieces that you mentioned. Second is sanitation. I think that's a tremendously important aspect of it. And the third is broadly what I would call healthcare education and awareness. We're definitely doing a lot on the first and the third. Not so much on the second, but we would. I think that is a role that the government is playing. We would be supportive of it, but certainly we're doing a lot on the third. Simple things. We are an urban model. Just as a clarification, we are not yet rural, although we eventually like to be. But on the third, we're doing things like at schools. We've in the last year we've taught about 12,000 students CPR. So simple things like that. I think those are all important for the healthcare education perspective and awareness perspective.
So last question before we end this session.
Sir, when we talk of Indian healthcare system, we forget real Indian healthcare, that is Ayush. So why not to make this a focus so that it's a huge industry also?
Point very well taken. In fact, when we were looking at the panel, I did try and search out if there was an early player or a startup which was basically trying to work in the space of Ayush or in our traditional healthcare model. Unfortunately, I did not find anybody who had sort of scaled the model to a certain extent, and we wanted people on this panel to be really those who have disrupted the entire ecosystem. So, but point well taken, and I know that there are a couple of companies which are trying to do that, and hopefully they will get there. But that's definitely an area that we should focus on. So let me try and sum this up. We've had 2 sessions over here. We've had healthcare version 1.0. We've had healthcare version 2.0. I know that for certain that there will be many more versions and many more waves of the way that we want to see the Indian healthcare ecosystem evolve, transform, disrupt, and innovate. But more than everything else, there is this energy which is going on in the Indian healthcare ecosystem right now, where there is a thirst for change. Whether it is from the established players who want to make a difference and make a change happen for the positive, and therefore from a consumer perspective, deliver to a new healthcare ecosystem. And the panel, as you saw over here, which is innovating dramatically in the way that the consumer wants to receive healthcare. So, great opportunity, enough and more challenges, both capital and non-capital. But more than everything else, I think, as I said right in the morning, a great time to be in the Indian healthcare ecosystem. Thank you very much. Thanks for the panel and for the exciting conversation. Thank you very much.
Thank you, Mr. Bali, and a very big thank you to all the panelists.